Hi everyone. Today, we'll explore the lesser-known benefits of omega-3 and the research on its potential for preventing various health conditions. Omega-3 fatty acids have been making headlines for their potential health benefits, but there's a lot more to know about this essential nutrient. Whether you're a health enthusiast or just curious about the latest nutrition trends, this video will provide you with valuable insights into the secret world of omega-3. So sit back, relax, and let's dive in. You rarely hear about omega-3 fatty acids in the context of improving memory and learning processes. According to research, DHA, a type of omega-3 found in fish, can actually help improve cognitive function in middle-aged adults. In fact, it has been linked to better performance on tests of mental flexibility, working memory, and vocabulary. But that's not all. In another study, researchers found that DHA supplementation for just 6 months improved reaction time in working memory in men and episodic memory in women. So what's the science behind this? Well, it turns out that DHA can increase synaptic plasticity in the hippocampus, which plays a key role in learning and memory. So, if you're looking for a natural way to boost your brain power, it's worth thinking about adding omega-3 to your diet. You'll find the highest amounts in fatty fish, such as salmon, and of course, dietary supplements. Your brain will thank you. Another interesting and little-known benefit associated with omega-3 fatty acids is their beneficial effect on cognitive skills, especially in the elderly. Studies reveal that consuming oily fish rich in omega-3s can help reduce the risk of cognitive decline in the elderly subjects. Evidence suggests that consumption of EPA and DHA, which are different types of omega-3 fatty acids, may reduce the risk of cognitive decline in people with mild cognitive impairment, memory complaints, or without diagnosis of dementia. One study of healthy men and women found that higher omega-3 intake was inversely associated with cognitive decline. Another study found that cognitive test scores were higher in older people taking fish oil supplements than in those not taking them. In addition, a recent meta-analysis examined the benefits of omega-3 intake in randomized double-blind placebo-controlled trials in healthy individuals with mild cognitive impairment or Alzheimer's disease. The analysis showed that omega-3 had beneficial effects on immediate recall, attention, and processing speed in people with mild cognitive impairment. So next time you want to skip a plate of salmon, think again, because omega-3s may be the key to keeping your brain sharp and healthy in the long run. Attention deficit hyperactivity disorder, commonly known as ADHD, is a neurodevelopmental disorder that affects a significant portion of the population, especially children. It is characterized by symptoms such as hyperactivity, impulsivity, and inattention, which can cause significant impairment in daily functioning. In recent years, interest has grown in the potential of omega-3 fatty acids to improve ADHD symptoms. Studies suggest that omega-3 supplementation can improve ADHD symptoms in children, as measured by teacher or parent rating scales and questionnaires. In contrast, another study showed similar results, with a significant reduction in hyperactivity or impulsivity in the omega-3 group compared to the placebo group. There are also studies conducted on a smaller group of people with equally promising results. In one, all 16 children who took omega-3 supplements showed improvements in hyperactivity and inattention over baseline in just 8 weeks. Despite some limitations in the study, including a small sample size and short treatment periods, the study authors believe that omega-3 supplementation appears to be a promising treatment for ADHD in children. So, if you're looking for a natural way to boost brain power in your child with ADHD, you can try adding more omega-3s to their diet. Salmon, tuna, and sardines are all great sources of this essential nutrient. You might also consider giving them an omega-3 supplement, but remember to never give children medications or supplements without consulting a doctor. Children have more delicate bodies than adults, making them many times more vulnerable to potential risks. There are many studies on the effects of omega-3s on aggression levels, but those conducted on prisoners seem to be the most meaningful. One study was conducted on 231 young adult prisoners in the UK who were assigned to a group receiving omega-3 with vitamins and minerals or a placebo group. Those who received the omega-3 capsules committed 26% fewer offenses compared to the placebo group. However, the levels of fatty acids used in this study were much lower than those often used when examining the effects on aggression. A second trial conducted in the Netherlands with 221 young adult prisoners showed even more impressive results. The study repeated the first one, but this time it used much higher doses of fatty acids. Rule-breaking incidents, which included aggressive or disruptive behavior and incidents involving drug possession or use, decreased by 34% in the omega-3 group, while there was only a 14% decrease in the placebo group. If you read the title that omega-3 can literally save a person's life, you'd probably think it was clickbait. But it turns out that some studies have shown that regular consumption of omega-3 fatty acids can have a significant impact on reducing symptoms of depression and even suicidal tendencies. In Finland, a study was conducted on more than 3,000 people between the ages of 25 and 64. Those who consumed fish at least twice a week had a significantly lower risk of depression and suicidal thoughts than those who ate fish less frequently. Similar findings were discovered in a study of 265,000 Japanese participants over 17 years, which found that those who ate fish daily had a reduced risk of suicide compared to those who ate fish less frequently. These studies are promising, but large-scale intervention studies are needed before dietary recommendations can be applied to depressed patients or the general population. The remarkable effects of omega-3s mentioned today are just the tip of the iceberg. In fact, we could write many books about omega-3 alone. Finally, remember that we should always consult a professional before making changes to our diet or supplementation. Although the consumption of omega-3 seems to be without drawbacks, in fact, consumed in too large quantities, it can cause the opposite effects and risk our health. If you liked the content, don't forget to like and subscribe. Thanks for watching, and we'll see you in the next episode.